Atenolol versus Losartan in children and young adults with Marfan syndrome. First, we have the definition. Marfan syndrome is an autosomal dominant disorder of connective tissues affecting approximately 1 in 5,000 people. One cardiovascular disease, mainly progressive aortic root dilatation and dissection, is a leading cause of death in Marfan syndrome.
To remember the key characteristics and the important features, I remember that Miss Marfan is tall. M for mitral valve prolapse, which is a common risk factor for infective endocarditis. I for incisional hernias, which are hernias in surgical site. S for spontaneous pneumothorax. S for scoliosis and kyphosis, which usually causes back pain in Marfan patients. M for myopia with link subluxation. A for arachnodactyly, which is basically long fingers. R for retinal detachment. And F for flexible joints. A for aortic aneurysm due to cystic media necrosis, which is a very common target of questions. And finally, N for numerous fractures. The genetic cause is a mutation of the fibrin 1 gene, which is located in chromosome 15. And the most common cause of death is aortic dissection.
The angiotensin II type 1 receptor blocker, Losartan, has been shown to attenuate TGF-beta signaling in some disease states, such as chronic renal failure, presumably by decreasing the expression of TGF-B ligand receptor and activators.
Your heart pumps blood around your body through a network of blood vessels, known as the circulatory system. Your blood then supplies the cells in your body with the oxygen and nutrients they need. If your doctor has prescribed you beta blockers, such as Atenolol or bisoprolol, it may be because you have an abnormal heart rhythm, or angina, or heart failure, or had a heart attack. Beta blockers work by blocking the actions of hormones called adrenaline and noradrenaline. These hormones make the heart beat faster and with more force. Blocking them makes your heart beat more slowly and with less force, which reduces your blood pressure and the strain on your heart. Before you stop or change any medication, even if you're worried about side effects, talk to your GP first, as changing or missing a dose could harm your health. For more information about beta blockers, visit bhf.org.uk/beta-blockers.
First, we have the Losartan therapy in mice with Marfan syndrome, prevent elastic fiber fragmentation, and therefore preserve aortic wall architecture. Losartan also decreased the rate of aortic root dilatation into a small series of children with Marfan syndrome, and the rate of change in the aortic root S score over the 3-year period did not differ significantly between the Atenolol group and the Losartan group.
So the NIH Marfan trial is going to be the biggest trial for Marfan syndrome ever done. It's a trial that's sponsored by the NIH, so it's funded by the federal government, and it's being run by the Pediatric Heart Network, which is a research network that was started in 2001 to try to do research on kids with heart disease with a long-term goal of improving outcome. The Marfan trial was started in 2007. And in the course of the trial, we've recruited 608 young children and young adults. Half of the half of the subjects are getting Atenolol, and the other half are getting Losartan. We do know that children and young adults with Marfan syndrome are tolerating both of these medicines very well. In addition to trying to figure out which medicine is better at slowing your aortic enlargement, we're going to learn a lot about side effects of the medicines. We're going to learn whether these medicines are helping other parts of your heart, your mitral valve, your left ventricle. We're looking at the effect of these medications on growth, on your skeleton, whether these medicines affect your pectus or your scoliosis. So we're going to learn a great deal, not only about the effect of Atenolol and Losartan on your heart, but also on the rest of your body. We've all invested a lot of time
The rate of aortic root growth among mice with Marfan syndrome treated with Losartan was similar to that among wild-type mice and was significantly less than that among untreated littermates with Marfan syndrome. Also, the beta blocker propranolol also reduced the rate of aortic root growth among mice with Marfan syndrome. This effect was much less pronounced than that seen with Losartan. In conclusion, this trial involving children and young adults with Marfan syndrome and aortic root dilatation did not show the expected advantage of Losartan over Atenolol. Thanks.